supplements can replace a balanced diet.
Both have their role to play. One cannot replace the other, but they work brilliantly hand in glove.
I'm assuming these roads are not like Mumbai roads where the holes are bigger than the road itself.
Actually, the roads are in the holes.
Yeah,
rather
think
the
about the
holes,
road that you're on, guys. Do you have a flu survival kit at home? Tissues? Check. Thermometer? Check. Blanket? Check. It basically has everything that you need for the test series of endless sneezes and sniffles. We're talking runny noses, watery eyes, fevers, stubborn cough, all the greatest hits of the sardi khasi season. And I think as toddler parents, we can all agree that these days are the worst, which is why we are back to share our worries out loud, to swap some survival tips and figure this out together. What's really growing on? The podcast about growing kids and growing questions. This is for every mom who juggles office meetings and bedtime stories, deadlines, dance class, sleepover drop-offs, for every parent just trying to bust myths. Because raising children, it isn't just about growth charts or milestones. It's, I think, about recognizing the signs of growth. And today, I'm with the best of the best, Dr. Nihar Parekh, who's going to help us unpack this concern, not as an expert. I want to unpack this just as a parent, as a mother, who's really desperately trying to figure out how and if we can break this cycle. So please tell me, Dr. Parekh, if there's one, and just say yes, there's a magic spell, there's a piece of advice. Can we just put our children, and more importantly us, because our children are resilient and they will figure it out, but we stress so much. So how can we put an end to this cycle of illness? Is there something that we can focus on to reduce the frequency of these sardi zukams?
So Soha, you'll be surprised to hear this, and I hate breaking our mothers' hearts, but there is no magic pill. The magic pill is a combination of things. If there were something, we would put it out there and make sure all parents have it. But it's a true test of patience. And I wish I could give you that. But the only thing I'm here for today is to make your life way easier. So you have all those solutions as en masse to handle these problems. But the key pill, part of the magic pill, is nutrition. And the second biggest part of the magic pill is patience. I know it's really tough. These are hard days. Sickness is everywhere. But if you focus on the long-term goals and don't look at that immediate one thing, 1 point, 1 time solution and you're sorted, I think you'll go way easier on yourself and your child.
Yes, and I think that key is to go easier on ourselves.
Exactly.
You had me at magic pill when you said, but I understand that it takes more than just one magic medicine.
Yes.
And like you said, patience. I wish that we had some more patience, because we want our children to get better right then.
Correct.
But that's not going to happen, obviously. So I can tell there's some days, Dr. Parekh, when I feel like even I know that I'm overreacting. But I feel I have become on a first name basis with Santosh, who is my chemist down the road. I feel like I should be inviting him to my daughter's birthday parties before I'm inviting anyone from the family or her friends. So how can we reduce this stress? How can we try and make this situation better? You referred to nutrition, you referred to patience.
So I tell all the mothers that if I run out of medicines at my chemist, I'm going to call you, because you all are stocked up.
Yes, it's true.
Stocked up and how? Backup. So medicines are everywhere. And it's unfortunate because the sicknesses are never ending in this city.
Yes.
So you rather be well prepared. But you have to understand every pattern of sickness. One approach to sickness, and the most important one, is to treat it. And at that time, you have to be very calm, very patient, do those meds. I tell every mother that first 2 days of fever, you wait and watch. Number 2, never get scared of the severity of the fever. It also means that the immune system is working well.
Correct.
Because that's your child's body fighting the bug, causing a war-like environment, all those symptoms of loss of appetite, headache, body ache, vomiting, nausea, and the body kind of resting and sleeping. A lot of parents get scared that my child is just dull lying in a corner. Old days they used to say, sleep it out.
Yes.
And that's what works best.
Yes.
So sleeping your child is actually conserving energy. so that later the entire focus is on fighting the sickness. So 2 days wait, let the fever break. If the fever doesn't break, it's crossed 48 hours, go to your pediatrician, try and find the underlying cause. Now, your pediatrician, out of his or her skills, is going to figure out the diagnosis either on clinical examination and or blood tests.
Right.
And once you treat that, post fever going, post 24 hours of no fever, that's when the recovery is going to start. And that's where the nutrition again comes into the picture to help the child rebuild, bounce back, and with every passing sickness, build immunity.
So what I'm taking away from it is, of course, patience, because it is a process. And as we know, some of these some of these diseases, these illnesses take time, firstly, for them to even develop, for you to know what you're dealing with.
Correct.
But I want to start at the beginning. We're very protective about our children when they're born. We keep them away from a lot of social situations. We are aware of their immunity building. But at some point, they go to school. They go to play school now. You know, in a time where perhaps I was maybe 5 or 6 before I interacted en masse with so many children.
Yes, yes.
But now from a young age, I think I was 11 months when I started taking to mother toddler, and then she was 17 months when she was going by herself. And as a result of that, of course, you go to your first play school and you subscribe to your first bout of colds and coughs,
Yes,
right?
Yes, that's what you signed up for. And let me direct a movie for you in a minute right now, okay? So you're happy, you're pregnant, you have a little baby, you've been eating well through your pregnancy, you've been giving all your immunity of whatever you eat through the placental blood flow to the baby, that's what we call as innate immunity. The immunity.
First, tell me the genre of this movie. Is it a horror film?
No. It lands up, it's got the ups, it's downs, it's got its, what we call as drama.
Okay, good.
Some tragedy, but all is well that ends well. So we'll start with the beginning. So happy times, we get the baby out, you're eating well. Up to the last 6 to 9 months, all the organs are being formed, the immunity starts developing through you.
Yes.
So if you keep yourself healthy through that last phase of pregnancy, the baby is going to come out at 2.5 to 3 kilos, normal, with busting immunity from you, transplacental. Then you start feeding.
Right.
Now, some mothers are fortunate enough to breastfeed and some are not. I mean, we don't judge, but as long as we do what's best for the child. So if you're breastfeeding, all your immunity is constantly going through the breast milk, and then they step out. So first 2 years, all the immunity that the baby gets is from 3 things. Your transplacental, which weans off in the first year. The vaccines that we give in the first, 90% of the shots are in the first 2 years.
Right.
So by 2.5 to 3 years, where you paid that massive amount of fees to sign up in the fancy preschool, they are ready.
Yeah.
They are ready to face the world.
Okay.
But that's not where it ends.
Right.
Because now they're out in the real world and they're going to face 20 other kids coughing on their face.
Yeah.
Everyone's doing their best. We are in a part of the world we call tropical, where the diseases are there. There's so a lot of patients who come from abroad, they ask me, which is the best season to come to Mumbai? I say, you know what? Come around the year, it's the same.
It's the
So
same.
they have to go through these sicknesses.
Right.
And that's when the environmental immunity develops, the external immunity. A combination of innate, a combination of environmental immunity, sicknesses back and forth. Every sickness is going to build a little immunity. Every sickness. So this is what you got to keep telling yourself. When your child is falling sick over and over again, fevers every 15 days, and my parents are going mad, doc, what is going on?
Yeah.
And their favorite word is, there is something wrong with my child's immunity. And that's where we tell them, look, this is how they're building their immunity. Your job after 2 years is nutrition. And let the environment do its rest.
Right.
And then by 5 and 7 years, they become rock stars. Take them any part of the world and nothing happens, as against our cousins who fly down from the US.
And immediately they're down
have
and
one
out.
save puri and they're out in the hospital because they've not been exposed to what your child is getting.
I tell them, if you're visiting India, if you're visiting Mumbai especially, then come for more than 2 weeks.
Correct.
Because the first week you'll be
Absolutely.
just adjusting
So
to a lovely environment.
this is your movie right there.
But I want to ask you, so what is really helpful for me is to say that they are prepared. When we send them to that preschool, when we send them to school, they can handle those bouts of illnesses. Of course, I want to bubble wrap my child when I send her to school.
Yes.
But a mother told me, she said that if your child has coughs and colds, that means she's a friendly child and she has friends.
Correct.
As opposed to being isolated,
Correct.
nobody wants to play with her.
Correct.
So I
Correct.
try and hold on to that.
Correct.
So the big question is, because you mentioned that word immunity, and that foundation that we can lay for them in their early years that will help them deal with illnesses and disease
Correct.
that life will throw at them, the environment will throw at them later.
Correct.
So how can we, as parents, step in, like you said? Our job is nutrition. So what can we do?
So nutrition is basically a well-rounded diet. So again, when it comes to nutrition, there is no magic pill. There is nothing like a magic diet, or a lot of parents, doc, I want to see the best nutritionist in town and I want to do what's immunity building diet. And I always tell them, follow the colors of the rainbow.
Even in school now, Jesus, thank God.
I mean, everything. You got your nutrition pyramid, you got your proteins, you've got your vitamins and minerals, you got your carbs, you got your fats, all in the right proportion, have a phenomenal role in immunity building.
Right.
As the children grow old, we want them to step out. They play. Play is excellent for them. It helps them get exposure to sun. It gets their good hormones pumping,
Right.
cortisol. All of these are natural immunity building. And then you have your nutritional support.
Right.
Those certain vitamins, which are known to be immunonutrition, what we call, to help in recovery from sickness and help prevent sickness.
That's before we go into
Correct.
and delve deep into the nutritional aspect, I want to underline that for a lot of parents. Basically, what you're saying is don't lock the door on germs. Those germs are important. That exposure is important because that's how you build your immune system, and that is how we're teaching our children and their bodies how to deal with the inevitable and sometimes the desirable environmental aspect.
Now you talk to my parents, talk to your parents, post 3 years of age, 5, they didn't know where we were in the summertime.
No.
We were playing in the garden,
Yeah, in
we
the
were
mud.
putting in the mud, nothing.
Yeah.
We grew up okay.
Yeah. Some of us,
Yeah. So what I'm trying to say is they were not entirely wrong.
No, exactly.
So a certain amount of exposure is extremely important to build natural immunity.
That's wonderful to know.
So as is another thing, I have a lot of parents who come to me continuously and they're struck by this worst bug called comparison. They have their kids going to school and there's a constant comparison that why my child of the same age looks way younger, smaller, petite.
Yes.
And maybe my child is not growing. They're highly concerned. We are obsessed as mothers and parents with numbers. X amount at this age, X amount at this age. And this is what then I spend some time trying to explain every parent. Then number one, don't compare. It's only going to give you heartburn.
Why do we compare so much? Is this a cultural thing?
It is because you'll have your aunt coming and telling you, "Arey, kya khila rahi hai
Yeah,
usko?"
it's the aunts.
Yeah, it is. The agony aunts who give you agony. Yeah, so basically their job is, even till date, if I meet my aunt who's 80 years old, in Gujarati, bahut patlo thai ho. So the first thing is a physical appearance. And
Yeah, it's
that's
so true.
somehow come to us, and now we are also in that bandwagon of comparing our children. So it's not a bad thing. It's out of concern and love. But
course.
if it is causing, any chance of misjudgment on your side, and that's when you panic and then tend to do the wrong things. Give me the magic pill. I want
Sure.
this to. So I want every parent to realize today that growth is not about numbers. If your pediatrician is happy, do not compare your child because he's already seen the basic milestones that need to hit. And number two, every parent has to understand the signs of growth. The signs of growth are not just the muscle growth, the bone growth, the height, the weight. My child can run faster than this one, throw longer, leap longer. No, it's about the overall growth. It's external growth, what the parent can see, and internal growth, which is all about the immunity. So these signs of growth is what every parent should watch for as their child grows. Physically, and internally, how can they visualize that the immunity is growing? Yes, as they grow, you will see the number of sicknesses reduce.
Right.
As they grow, you will see that the sicknesses are not lasting that long.
I'm seeing that.
Correct. And as they're growing, you will see that their response, they bounce back way faster.
Yeah.
So if these things are happening, these are phenomenal signs of growth.
That's so heartening to know because Inaya right now has a cold, but I can see just in the space of 2 days, that her recovery, her ability to handle that cold, from blowing her own nose to still being able to do a class that she had today, her mood, her energy levels, her appetite, much better, stronger than, for example, 3 days ago. So having survived a Sardi Khazi season, hopefully, what is the playbook, Dr. Parekh? For example, what can parents actually do during a child's illness, and more importantly, perhaps after they have recovered, after that fever has broken, to help them bounce back faster?
So this is a very important point that you brought up because, I swear by this when I spend a lot of time talking about the sickness when parents come to my clinic. I also tell them what to look out for in the next few days to raise less alarms. Because the more you know, the calmer you are.
Right.
The calmer you are, the lesser the panic and over medication becomes less.
I believe that.
So during the sickness time, your child is not going to eat.
Yeah, I know.
Let's drill it in our hearts and minds and souls and, the emotional bit also. He's not eaten anything since 3 days.
But especially when we're medicating, and
Correct.
you know that
So now, again,
having that
bust-
medicine on a full
yes.
stomach is
So
important.
let's bust some myths here. Take this opportunity. During sickness, your child is not going to eat.
Yes.
Period. Your job as a parent is to offer. Offer simple foods that keep them hydrated. Offer, not force. Porridges, khichdis, soups, homemade lemonade, coconut water, buttermilk. These are fantastic, naturally occurring, available homemade ORSs.
Right.
Small quantity meal at small intervals. Don't push. If they take well and good, otherwise you let them be. As long as they're not vomiting. And as long as they're passing urine once every 4 to 5 hours, they're clinically not dehydrated. So don't panic even if they have nothing. Now, once the next step of the playbook, once the fever is gone, then what? How do you build their immunity? And this is where the nutrition comes in. And there is something called what we call as the ACE, A-C-E, that every parent should have at the back of their pocket in form of vitamins. It's vitamin A, vitamin C, and vitamin E.
It's a good name. Ace.
Yeah, and you can add a little bit zinc. So it has A to Z, that's ACE, and the zinc.
Got it.
So vitamin A is fantastic with naturally developing immunity as they recuperate. It covers the superficial surface of the nasal passages, respiratory passages. C is excellent for your cells to fight bugs and help them recuperate. And E, like we all know, we use for our skin and hair, excellent antioxidant.
Yes.
So when that goes in, it's fantastic recovery. And the zinc is automatically for cell damage repair. So if every parent remembers this, because nutritional supplementation after sickness is the key path to them bouncing back and preventing further sicknesses.
I think that's very important. So hydration when they're unwell is a key takeaway, and then you can think about the nutrition. And it's wonderful to have specific takeaways like
Correct.
ACE and Z.
Correct.
So now I know we can call them the superhero squad
Yes.
of immunonutrients. But I do want to tell you, like you referred to the aunties, we are constantly bombarded all the time as parents with advice.
Correct.
We also seek out that advice from the internet, whether it's ChatGPT, who's my 3 a.m. friend. And also, I'd like to tell you that they do also say when to go to a
I know,
doctor. And of course, before we go to GPs now
Yeah.
and pediatricians,
Yeah.
mothers speak to other mothers.
Yes.
Which is also very helpful. That
Correct.
community is very helpful.
Correct.
But it brings me to my favorite segment of this podcast, which is Fad versus Fact, which is brought to you by Nestle Nangro. And I would like to take advantage of you being here so close to me and all your wisdom, Dr. Parekh, to help us bust some popular parenting myths.
I am super excited and happy to do so.
Okay, so number one, if you keep your child indoors and germ-free, they will not fall sick.
That's the number one myth that we should bust. We are not stupid parents. We are not going to push our children towards sickness. You have 3 sick people around, yes, you're going to be protective. But there is a fine line between protection and overprotection. And overprotection is sometimes leading to your child's immunity not growing.
Right.
So what we keep saying, signs of growth has a very important part of immunity to play. And that will only develop with time if they get piecemeal exposure to naturally occurring allergens and antigens in the form of virals and bacterials.
Yes.
They get it, their army gets stronger, and soon they've outgrown all this. And like I said, they become rock stars.
Right. Myth number 2, supplements can replace a balanced diet.
So I always take supplements as those fillers in the cracks of the pavement. Now you have a nice pebble road, you have the big pebbles, big stones laid out as your macronutrients, your proteins, your carbs, what we spoke about, the minerals, the natural pyramid, the rainbow diet. Yes. And then you have those cracks which are there between those stones, which you can trip on. Yes. So if you fill those gaps with right amount of vitamins and nutrients, you get a nice, smooth, even pavement to growth. So both have their role to play. One cannot replace the other, but they work brilliantly hand in glove.
And we're assuming these roads are not like Mumbai roads where the holes are bigger than the road itself.
Actually, the roads are in the holes.
Yeah,
rather
think
the
about the
holes
road that you're on, guys.
Yes.
So myth number 3. Once a child recovers from an illness, then nutrition can take a backseat.
That's a complete fad and not a fact. Nutrition is the key for recovery. Like I said, the child has been sick, not eaten, lost weight. They don't get scared even if they do. They bounce back, they bring it all back very quickly. So the key to recovery, and not only recovery, but you have to also remember that once they're sick, their immunity is going to stay low even after recovery. So to prevent another, what we call as a secondary infection,
Right.
your primary pillar is nutrition. It's extremely, extremely important to get the right nutrients, like we spoke about, the ACE, as soon as possible to get them back on track. Also, what we strongly recommend is once they're up to it, get them out in the open. I mean, it's a rainy day, no, but if it's nice and sunny, get them out, get the good hormones pumping, get the naturally occurring vitamin D, and get their moods elevated.
Yes.
Because that too also brings them back on track very quickly.
Like all of us.
And like I said, every time you get wiser, you look for these naturally occurring signs of growth in your child. It's going to bring your heart to joy and see, look, my child, suddenly I forgot to use these medicines. They're all expired now. It's been a while. I'm like, what just happened?
Yeah.
And that's your child growing. Those are the actual signs of growth.
Oh, nice. Last myth, myth number 4, that outdoor play is only for physical fitness.
I think outdoor play now just works on mental for all of us. Mental, emotional. It's your disconnect from the society. Going down to play in today's day and age is a rare entity, but is my most favorite thing for a child to do.
Yeah.
Get the good sunlight, like I said, whatever freshness is left in the air here,
Yes.
and the good hormones pumping.
Yeah.
Extremely important. Get them out there.
So true, and thank you for stating that, because obviously it is so much easier to absorb when a doctor tells us these things that we know in our hearts, but they need to be reinforced by a professional. And it helps to clear up so much for us. So basically, guys, no germ-free bubble, no complacency around nutrition, and please no thinking that you are done once the fever breaks, because that's when you have to really build on the immunity and on the building and on the nutrition. Right?
Perfect.
Okay, so you've heard it from Dr. Parekh, guys. This is our immunity playbook for the season. Less panic, more preparation, and maybe fewer late-night pharmacy runs as a result. Correct?
Absolutely. So this is the gospel truth. You know the playbook. You need to show patience. You need to know what to expect from your child as they grow. As a parent, you don't need to compare, and look out for the internal signs of growth. Because when you go above and beyond the numbers of height and weight and see the magic of lesser sickness, growth is that true growth. So signs of growth are not only physical, also immunity based. So you know what? Give yourself a pat on the back if you see that happening. It means you've arrived.
Thank you so much, Dr. Parekh. It is always very illuminating to have you with us and to really help us navigate these things that are quite tricky sometimes for parents, especially when their children are ill. So thank you very much for your time. That's it for today's episode of What's Growing On. And if you have your own cold and cough survival hacks, then do share them with us. And until next time, please keep those little superheroes strong.